In Canada, health officials are warning the country is set for several intense weeks of COVID-19 activity. But in South Africa, where the Omicron variant was first detected, the wave has already passed its peak, perhaps offering hope to other parts of the world. Dr. Angelique Coetzee is the chair of the South African Medical Association. She is joining us now from Pretoria. Doctor, nice to talk to you today.
Good evening, good afternoon from Pretoria.
That's okay. Good morning for us. Exactly. All right. So you were one of the first doctors, I understand, in South Africa to treat Omicron patients. How did you know that you were dealing with something different than previous strains of the virus, like Delta?
Very good question. You have to understand that I'm a clinician, and this is our fourth wave. The Alpha, the Beta, the Delta, and the Omicron. Each of them had their own clinical presentations. And although they will all test positive on a rapid test, clinically, the history that the patient will give to you are different. And that's how that day, for about 8 weeks, we didn't see any new COVID cases from Delta. All of a sudden, I saw 7 patients with a different clinical picture, different history, and it was clear to me that this is not Delta. And I then started to alert the authorities.
Was there some symptom in particular that really stood out to you that was a common thread through these new patients?
Yeah. So the patient 0 was very adamant that, you know, he thought that he had sunstroke because his body was sore, he was fatigued. And it was hot in South Africa the previous 3 days before he came to me. And he contributed to that, as well as body aches and pains, you know, and a bit of a sore throat, more a scratchy type of throat. And that didn't fit in with his age group, it didn't fit in with his as a person. And I then tested him, and then interestingly enough, his rest of the family also made an appointment for that day, which is also very uncommon. And when I tested the rest of the family, they all tested positive, including the 4-month-old baby.
Oh, wow.
Very interesting.
What was going through your mind when you're, starting to connect the dots and say, okay, wait, this is not like what we've seen before? What were you thinking?
Yes, if you have treated Delta patients, and you saw the devastating effect it had on the families, on healthcare, and you as a doctor as well. I think that will for any ordinary doctor, it will lead to PTSD going forward. And the first thing that came into my mind when I realized this is something new, this is something different, was not again, please. And it is just before Christmas. We really need a break. And so, it's that heart sinking feeling. And then immediately, there's no time. There's no time to feel sorry for yourself. You need to act. You need to do something.
So when we look at that time, South Africa went from an average of, about 23,000 cases a day in the middle of December to now, we're looking at the number on our screen, 4,637. That was logged on January 18th. How has South Africa been able to flatten the curve?
Very interesting question. So, I thought a lot about this. And for me, and I know a lot of scientists will not agree with me, but for me, it's a hit and run type of viral infection or variant. It hits hard, it peaks quickly, and just as quickly that after peaking, it starts to decline. It's not the same pattern than any of the other variants that we have seen. So part of that question or the answer lies in, I think it's part of the characteristic of the viral infection. Yes, it is also maybe the combination of vaccines, previous infections, breakthrough infections, again, with patients had before COVID. It's our 4th wave. It's been nearly 2 years going on. So a lot of people will have immunity or partially immunity.
Yeah, I want to ask you that. I mean, there's so much conversation around should we be talking about the case numbers or should we really be focused on hospitalizations? What's your take on that?
What I've noticed is one of the problems is the moment that there's a high positivity rate, the media and the politicians and the scientists starts to say, we're going to be overwhelmed, the hospitals are going to be overwhelmed, and everyone is talking in that it's a sort of a fear conversation that we're having. Instead of saying to the people, listen, I'm happy that you have tested. We can take you out of circulation. We can get you isolated. Your infection rate would go down because there's less people that's infected that can spread the virus. We thank you. Please, if you've got the following symptoms for the rest of the population, please go and get tested. And then immediately you actually then need to say, look, the ICU and the high care, there's still space. We're still not overwhelmed. There's no reason why your healthcare system should be overwhelmed with mild symptom patients lying there.
Right.
We have seen the symptoms is about 3 to 4 days, and the patients get better. It's the ICU that's the problem.
Right, and we should
and
be
your
focused
healthcare.
Yeah, exactly. Well, Dr. Angelique Coetzee, really fascinating to talk to you this morning. Thank you so much for your time.
Thank you so much, and please stay safe.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.